Night Adebo, MD. I'm a physician with over 15 years of experience in clinical practice. I want to talk to you today about how you can stay healthy and strong in the middle of the coronavirus crisis. I will talk about how you can prevent infection, what to do if you think you have the infection, or if you think you have the coronavirus infection. Lastly, I will talk about what to do and how to stay healthy and strong through the coronavirus crisis. First thing first is prevention. So there are three things you can do to prevent infection. The first thing is hand washing. Hand washing has been shown to be the most effective way of removing germs from your hands. You could wash your hands with soap and water for at least 20 seconds. You can also use the hand sanitizer. That would work as well. So you would put about a marble size of the sanitizer in the palm of your hand, rub your palms, the back of your hand on both sides, and wash your thumb and your fingernails on both sides. Maintaining your fingernails short will be important to prevent infection too, because the germs tend to like hiding under your fingernails. The second thing is avoid touching your face, your nose, your mouth, your eyes as much as possible. And if you have to, wash hands with soap and water. The third is avoid crowds and maintain the recommended social distancing. And so staying at least 6 feet away from other people is important. Most respiratory virus infections, most respiratory viruses such as the coronavirus tend to spread from person to person through close contact, and therefore following the recommended 6 feet distancing when you walk, when you have to go shop in the grocery store would be important. Now I'm going to talk about what to do if you think you have the infection. If you have cough, fever, shortness of breath, backache, body aches, headache, flu-like symptoms, it's possible that you might be infected with the virus. Therefore, testing would be helpful. Each city is different on where you can get tested, and every day new testing centers are being added. Therefore, staying up to date in your city would be important. If you're in doubt, you can ask your city's Department of Health as well. While you're tested and you're waiting the results, it would be important to prevent others from getting infection, and therefore proper and frequent hand washing, cover your cough and sneezes, and also if you are coughing a lot and you are living with your family, you may consider wearing a mask if available. And also you could do supportive care at home. You might have heard your doctor say supportive care. That means drinking plenty of fluids and staying hydrated. Warm soup, warm tea and honey tends to be our home remedy when we are sick with a cold or flu in our house. Rest. If you have fever, you can treat your fever with Tylenol or Motrin. Most young children and adults have been doing well with the infection so far. It has been reported that you will recover if you are a young adult or you have young children. You're likely to recover from the infection, just like a cold and the flu. However, if you are elderly, if you have underlying medical conditions, immunocompromising situations, such as cancer treatments, immunosuppressive therapy, diabetes, if you have asthma, chronic obstructive disease, COPD, and if you have symptoms, it would be important to seek immediate medical care. You can also contact your doctor if you are uncertain on what to do. I talk about how you can stay strong through this crisis. We all know that we are body, mind, spirit, and for us to be well, we need to be well in all aspects of our being. Just like you nourish and maintain and take care of your physical body, it's important to take care of our spiritual being, our minds as well. I have come to understand that it's our connection, spiritual connection, that matters, not which religious organization we belong to. With the current shutdown and inability to maintain spiritual gathering, it has become obvious that we need to start taking charge of our spiritual connection and not rely on spiritual leaders alone for that. Albert Einstein said that, I quote, "The intuitive mind is a sacred gift, and the rational mind is a faithful servant. We have created a society that has forgotten the gift." So society has taught us to suppress our intuition, our imagination, and rely on physical evidence for the most part. However, it's through this intuitive mind, our imagination, that we connect through high power, the highest consciousness, God, divine, the universe, whatever you want to call it. It's important to stay informed and to follow the news. However, if that's the only thing we're feeding our mind, it's going to cause a lot of anxiety, stress, and so balancing this with something positive will be important, such as prayer, meditation, you know, having quiet time, also going out for a walk. Although there has been the stay-at-home order in most places, most cities do allow for you to go out and walk as long as you maintain social distancing. Most gymnastic centers are also closed. However, you can exercise at home and not take the excuse of, oh well, I can't exercise now, the gym is closed. Most children are home, schools are closed. If you have children, young children or grandchildren, you can exercise with your kids at home in your backyard, involve them in physical activity. Also, you know, most restaurants are closed now too, right? And you are staying home, but it might be easy to revert into consuming a lot of unhealthy meals. However, avoiding packaged processed food at this time would be important. Involve your children, grandchildren, if you have to prepare and make a nutritious meal, and feed your physical body with healthy, whole, nutritious meals. And therefore, just, you know, nourishing your physical body, your mind, your spiritual body with something positive will help be strong through this crisis. I hope you found value in this video. If you did, please do subscribe, like, and share. I will see you in my next video. If you have any questions, comments, also feel free to leave them in the video below, or you can also reach me in any of the social media outlets by my name, Sanait Adiba. Until I see you next week, bye for now. Take care.